permit me to continue to health literacy in the WHO European region. We can shorten a little bit the coffee break, if you agree. And let's start with a video film, Voices of the Region. Can we have it, please?
Det känns så varmt i hjärtat att berätta för dem. Att de har informationen, den som jag inte. Mitt namn är Nuria Halimi. Och jag kommer från Afghanistan och har barn, barnbarn. Och jag bor i Karlstad. Så jag kom till Sverige för 23 år sedan på grund av kriget. Mitt jobb är att jag skulle ge information till kvinnor som kommer från Iran och Afghanistan och pratar dari och persiska. Och vill jag ge dem information om deras kropp. Och vad har de rättigheter och kan de göra med sitt kropp och inte gör. Och jag har olika filmer om olika ämnen. Så berättar jag för dem. När man kommer från annat land det är jättesvårt att lära sig språket fort. Och det här informationen som RFSU har på sina filmer, det är jättebra att de lär sig när de kommer, inte första veckorna eller första månaden, men så fort som möjligt för att det här informationen ger dem jättemycket kunskap om deras liv och deras kropp och deras rättigheter. För att det är stor skillnad. Om vi ger exempel med graviditet, att en kvinna blir gravid här i Sverige, barnen och blivande mamma blir kontrollerat varje månad eller 2 gånger i månaden, eller det beror på behovet. Men de känner sig trygga och självklart när de känner sig trygga. Barnen är trygga i magen. Den här tryggheten ger dem trygghet för hela vårdsystemet här. Jag är så glad att jag ger och hjälpte så mycket kvinnor att de kom och får informationen. För mig behövs inte att veta 1000 personer. Det räcker för kanske en person berättar för den andra och tredje och fjärde. Och de har redan gjort och de förstår lite. Så det är mycket. Det kom en mamma till mig och en flicka som var 11-12 år gammal. De var väldigt oroliga, särskilt flickan som var jätteorolig. Och vad händer om jag får mens? Och så frågade jag hennes mamma, går det bra om jag visar det här RFSU-filmen om mens? Det går bra. Så jag gick på en hörn med henne och så visade jag filmen till henne och så såg hon. Och så, men det är inte så farligt, Nej, det är inte farligt, det är normalt. Varje flicka får mens. Men det betyder att du är frisk, du växer, det är bra att du får mens. Och hon var väldigt rolig och bra. Och sen berättade hon för sin mamma. Jag har tittat på filmen handlade om det här, så nu är jag inte rädd längre. Det var ju bra.
Okay, so permit me, before the coffee break, to give the floor to Dr. Bente Mikkelsen for her presentation. Then we stop for coffee break, a little bit shortened, and then be prepared for a small agreed amendment in the resolution after the coffee break. Dr. Mikkelsen, please.
Thank you, Mr. Chair. Regional Director and Acting Regional Director, Excellencies, Honorable Minister Delegates, dear colleagues and guests. I hope you enjoyed the video. I've seen it several times. I still enjoyed it a lot. Thank you. As Director General mentioned in his opening address this Monday, progress can be made on many of the health challenges you are facing by arming people with the information they need to make healthy choices. When they have accurate, reliable information, people can be empowered to make decisions that protect their own health and that of their families and communities. And he said, the European Roadmap for Implementation of Health Literacy is an excellent first step. He left us with 3 challenges, and one of them was to commit to strengthen health literacy. The film you just saw was about knowledge and health literacy. And for those of you who also saw the film about cervical cancer and Laura Brennan, who died, who could have been protected by HPV vaccine if she and her family knew, and maybe her doctor as well, I think all of you see that there is a potential here. So I'm very happy to present the health literacy draft roadmap. This quote is from Ilona Kickbusch, who most of you know. And she was one of the big thinkers very early on and the initiator of health literacy. And in my view, she made this understandable. If you look at the definition on health literacy given by WHO in 1998, it is more complicated. It's about the cognitive and social skill which determine the motivation and ability of individuals to gain access to understand, use information in ways which promote and maintain good health. I think what you have seen is that the concept of health literacy has been further developed, and it's really evolving and a dynamic concept. Health literacy deeply affects people's ability to interact with health providers, make informed health decisions on lifestyle choices, engage in self-management, develop health-related digital competencies, as we have already discussed today, navigate and access health system, access health information, and understand health messages in the public domain. But in addition, and moreover, when we talk about health literacy, it is also important to take into consideration health literacy responsiveness. This describes the way in which services, organizations, and systems make health information and resources available and accessible according to the health literacy strength and limitation in their population. This is also sometimes called organizational health literacy. So through the life course, health literacy is a dynamic quality and maybe also quantity, and it applies to individual skills, but also societies and organizations. Many of you know that already in 2012, there was a measurement on health literacy through the European Health Literacy Survey, and it reported that nearly half of all adults in the 8 European countries reviewed had inadequate health literacy skills and gaps. We think that health literacy is one of the underused and promising means to actually reduce health inequity. So a little bit on how we got where we are today. The current work on health literacy has been informed by the discussion on the last year's regional committee and also through 2018-19 with the standing committee for the regional committee. We have had the pleasure of having 2 consultations, one with technical experts, and I can report that there is a lot of enthusiasm among technical expertise around the world, or around the region, but actually also in the world. Because this has been a pretty fragmented community. We also had a consultation with member states in June, and thank you for all the contributions. We are very grateful also with the big amount of inputs we have had from civil society, NGOs, and other organizations, including member states and their technical expertise. I have been allowed to be a little bit more lengthy today because we need to be sure that we all see the different dimension on health literacy. So, of course, we see that this enables people-centered public health strategies and programs both to be developed but also to be implemented. At the same time, improved health literacy in itself is a goal of public health, and it is defined as one of the key pillars in health promotion. Health literacy is considered to be also a social determinant of health, already seen in the Commission on Social Determinants of Health, and is seen as also a precondition for better health. It is a promising means to reduce health inequities. So low health literacy can be considered as a health risk, and is, on the contrary, if we are gaining higher level of health literacy, we stand in a much better chance to taking care of our own health, but also the well-being of our family, and also to be able to influence positively on the environment surrounding us. Enhancing health literacy facilitates the empowerment of citizens and is achieving through the development of personal and collective knowledge and skill. So you can see it's the foundation for building the individual and collective capacity of people to act as informed participants in decision-making about health and development, engaging multi-stakeholder and multi-sectoral environments, like also settings through the life course, like the kindergartens, the schools, the workplaces, the cities, and of course, as we just heard, through mainstreaming also into the old age. When we look at the mandates for health literacy, we can see that the political call for action related to health literacy has been on the rise. So both WHO, the UN, and other international organizations has called for health literacy. And I'm very proud that already through the Health 2020, this was one of the key elements as mentioned by the RD the first day. It was also emphasized in the Shanghai Declaration, in the 2030 SDG agenda, and now also in the GP13. We believe that investing in improving health literacy will help us to achieve all these targets. When we present the roadmap, we are really building on a huge amount of work in this region. I would say that the European region, with all its 53 member states, has been on the forefront when it comes to health literacy. We have already mapped that many countries have several national strategies and plans, also subnationals. They can present mechanism, and also there is a very specific project. We want to bring all this together in a comprehensive framework. WHO has already, in this region, established 2 action networks, one on population-based measurements, and the other one on implementation action through health literacy for NCD. In addition, we have already started to use all our networks in the region, and I would like to mention one example, that is the School for Health in Europe, and also the Healthy Cities, which has already started to implement modules on health literacy. You can also see awareness campaigns, especially in the area of communicable diseases. We have an excellent example through the WHO Emergency Risk Communication 5 Steps Capacity Building Package, and we are also moving very fast on digital health. What we hope to achieve is to empower for better health outcomes and equity. And we think by addressing governments, communities, organizations, and people, we will be able to make synergies and also to give practical guidance for all these different levels. So what action should we take? As you have seen from the roadmap, we have started, and this is actually a very intentional idea, because we see that there is a lot of ongoing. We don't want it to stall the whole activity by announcing a big action plan or a big strategic plan. We wanted to stimulate and already start to pick the best practices from the different areas. So we have suggested 5 strategic directions. One is to build capacity. Both capacity for policymakers, health professionals, educators, researchers, health service providers, investors in health-related portfolios, they are often forgotten, and others in the first step. For example, as I mentioned, the WHO 5-step capacity building package for emergency could very easily, with some work to it, be extended to other areas than emergency and represent a very nice example of how to build capacity. Another one is, of course, to align this activity with the initiative now on primary health care that you discussed yesterday. Another action is advocacy and also activating many sectors, partners, and organizations. For example, following the Paris Declaration on promoting citizenship and the common values for freedom, tolerance, and non-discriminatory through education from 2015, health, education, and social sectors are already committing to these kind of activities. Another one is, of course, a very successful network of healthy cities in this region, which very easily can be activated to extend their partnerships through the local government in their own countries. The third action is implementation of health literacy initiatives through demonstration projects. And we have already, together with the global level, had demonstration project. They are just reviewed and published. It is 7 countries in this region. Of course, these are smaller demonstration projects, but because we can see there is a research gap in this area, we want to demonstrate, we want to find the best practices and also to publish and disseminate. We will continue these kind of demonstration projects. Already this autumn, we will have a new number of countries, 10 countries from the Eastern European part of the region, defining their demonstration project. The fourth action is to consider the digital environment. And as we have heard in the coming years, or actually as Austria said already, we need to be able to address both how we can deal with digital environment, but also how we can utilize the digital environment for health literacy itself. The last action that we have, or the last strategy, is to continue to collect population-level measures. We have seen the big impact in those countries who has already been measured, and we think this is one of the ways to really shape windows of opportunity to address health literacy in other countries as well. As you can see, we have been pretty productive. And I'm very happy to see that, very happy to say that before this meeting, we have been able to launch a website. And it was a pleasure to see that already on the second day from the launch, people started to comment, they started to provide us with resources, and this seems to be very welcome. And of course, with the leadership of Christina Mauer-Stender in the DIR division, we have also, in a very short time frame, been able to publish a special edition in Panorama on health literacy, and also a new health evidence network report to really look into the aspect of measuring health literacy. We will call on all interested stakeholders to be very active and support WHO if we have the resolution adopted today and if we will have the pleasure to develop the action plan. So, Mr. Chair, this is my last slide, and I would thank to all of the colleagues in the regional office. This is an all-of-office strategy. It is not one programmatic area, it's really cross-cutting all the different areas. And I think you saw in the draft roadmap that we have an annex with 10 different, 12 actually, different cases. And you will see that this spans from health system through communicable diseases to emergency to NCD, and this is the way we want to work on this. And thank you very much for the opportunity to present on health literacy.